Hi, hello, welcome back. So today we will be seeing about CPT topic, lungs and pleura procedure, CPT code 32035-32999. This is a topic which is coming under respiratory system of CPT. For understanding this, the CPT codes for procedure involving the lungs and pleura covers a wide range of diagnostic and therapeutic intervention. Here is a detailed breakdown to help you understand these codes better, including definition, example and key points for accurate coding. The key concept of this is, first one is thoracentesis, CPT code 32554-32557. Thoracentesis is a procedure to remove excess fluid or air from the pleural space to relieve pressure on the lungs, improve breathing and analyze the fluid for diagnosis. Example, a patient with pleural effusion, that is excess fluid around the lungs, needs fluid removal to alleviate breathing difficulty. For this, we will be giving 32554 thoracentesis without imaging guidance code. Second example, a patient with small or loculated pleural effusion requiring precise needle placement under ultrasound guidance. For this, we will be giving 32555 thoracentesis with imaging guidance. This code is used when imaging guidance such as ultrasound is utilized for this procedure. Second example, pleural biopsy, CPT code 32400-32405. A pleural biopsy involves taking a small sample of pleura, the membrane surrounding the lungs, to diagnose disease such as infection, cancer or inflammatory condition. The example for this is, a patient with unexplained pleural thickening undergoes a biopsy to check for malignancy or infection. For this, we will be coding 32400 biopsy procedure. The next example is example to a patient with a difficult to reach pleural lesion requires a biopsy under CT guidance. For this, we will be giving 32402 biopsy with imaging guidance. This code is used when the biopsy is performed with the help of imaging guidance. Next, thoracotomy and lung resection. Thoracotomy is a surgical procedure that involves making an incision into the chest wall to assess the lungs or pleura. The lung resection involves removing a portion of the lung which can range from a small segment to an entire lobe or the lung. Example for thoracotomy is, a patient with a mediastinal mass require an open biopsy for diagnostic purpose. For this, we are coding 32100 thoracotomy for biopsy of the lung or mediastinum. Next, lobectomy. A patient with early stage lung cancer in one lobe undergoes a lobectomy to remove the cancerous tissue. For this, we are coding 32480 removal of lung other than pneumonectomy, single lobe lobectomy. The description of this code is used for surgical removal of one lobe of the lung. Next is segmentectomy. So in this, a patient with a localized lung infection that doesn't respond to antibiotic undergoes a segmentectomy to remove the affected part of the lung. For this, we are coding 32484 removal of the lung other than pneumonectomy, segmental section. Next procedure is pneumonectomy. For the example is, a patient with extensive lung cancer that cannot be treated with lobectomy or segmentectomy undergoes a pneumonectomy. Pneumonectomy means removal of the lungs. For that, we are coding 32440. Only one lung is removed. Next procedure is video assisted thoracic surgery, that is VATS procedure, code range 32601-32609. VATS is a minimally invasive surgical technique that uses a small video camera and instrument inserted through a small incision into the chest. Example is, a patient with lung cancer undergoes a VATS lobectomy to remove the affected lobe with minimal invasiveness. VATS lobectomy, we are giving 32663 thoracoscopy surgical with lobectomy. Next, VATS wedge resection. A patient with a small localized tumor undergoes a VATS wedge resection to remove the tumor with the margin of healthy tissue. For this, we are coding 32666 thoracoscopy surgical with wedge resection. Tips for accurate coding: we have to go through the documentation clearly, including the method, extent and any other additional steps. Differentiate the procedures, distinction between the different type of lung resection and thoracotomy procedure. Use modifiers correctly. Stay updated with the guidelines. That's all about this topic. Thank you so much for watching. If you haven't subscribed, please do subscribe and share it with your friends also. Thank you so much for your time. Take care. Bye-bye.